mask on or glass Oh, live with audio.
Oh,
Cyrus on the set.
We got this.
There?
Please speak for me, Kristen.
Sure. Can you hear me now? Is there anything that you can hear? Anybody hearing anything out in E-Town?
There we go.
Got it?
Got it?
Yay! Some of our special guest stars are arriving as we speak. Okay,
Solo.
hold on.
You'll have to start over.
That's fine. We're happy to start over again. Second chance is all good.
Just have
Yay!
the cameraman tell us when we go.
Richard says he can hear.
Yay! The crowd is wild. We did that so well, too.
Yeah, I know.
Kristen, give me a yay again.
Yay!
Yay.
Woo, woo.
We've got 2 confirmations. We're live. Yay! Okay, so do-over. Are we ready?
Ready.
All right. Welcome. I'm Kristen Dehart, the Chief Executive Officer here at Excelsior Springs Hospital.
And I'm Kent Powell, Chair of the Excelsior Springs Healthcare Foundation. And we want to welcome you all here tonight for this night at the hospital. Thank you for participating to make this year's annual fundraiser a success.
Proceeds from tonight's event will go towards purchase of specialized medical equipment to be used in our outpatient clinics. There are a lot of ways to donate tonight, and possibly some folks are going to score really big. We've got great things planned tonight.
That's right, Kristen. Tonight's event will bring you into this hospital, introducing you to medical professionals and services that are available to you here. But we also have many chances for you to win some great prizes.
That is right, great prizes indeed. We'll be drawing raffle tickets later this evening, so be sure to listen for your name to be called. There will be 10 chances to win $50, 10 chances to win $100, and one lucky participant at the end of the night will win $1,000.
Sounds to me like a good night. Tonight's going to be a good night for all.
And that's not all. We have a great silent auction going right now, taking place online. Bids will continue throughout our program, but it closes at 8 o'clock. We've got some really great auction items that we want you to win. We've got Coach bags, a new Weber smoker pellet grill, gorgeous handmade quilts and a throw, stunning stained glass window panels, amazing artwork, wine, sports memorabilia, and
don't forget the Patrick Mahomes signed autographed jersey.
yes, even an autographed Patrick Mahomes jersey. The generosity of our donors this year has been so amazing. We are humbled and so appreciative of our sponsors and our donors. They really are the reason that we're here tonight, and it is going to be a grand event. If you haven't checked out our auction site yet, you have about an hour left to get in on the fun. The auction site is easiest to get to if you want to go to our Excelsior Springs Hospital website and look at www.eshospital.org #night@ESH.
Tonight's program is being brought to you by the Excelsior Springs Healthcare Foundation. The mission of the Healthcare Foundation is to provide grants and raise money to help support the operations of Excelsior Springs City Hospital. Since 1971, the foundation has been working to benefit the health services being offered and help maintain and advance the quality level of care our hospital provides. All donors of $2,500 and above are recognized in our Hall of Honor located in the hospital's lobby. Representing the Excelsior Springs Healthcare Foundation, I extend our appreciation and gratitude to all that have and will donate tonight for your generosity and support of our mission.
Thank you, Dr. Powell. The Healthcare Foundation has contributed over $2 million since its founding. That's an incredible show of support for our hospital, and we absolutely wouldn't be the same without it. We're 116 years strong here at the hospital. Even in these trying times, we are continuing to move forward with the goals for our hospital. We're expanding services being offered in our outpatient clinics, and we've completely reorganized, bringing our primary care physicians onto the hospital campus. We're opening our new community pharmacy and many more things to come in our future. You'll get a look tonight at each of these new things in our program, but first, we want to have a word from one of our key sponsors, McCarthy.
Each year, the foundation recognizes members of our hospital staff by presenting Commitment to Caring Awards. The Commitment to Caring Award was established by the foundation to recognize not only staff, but community members also for their commitment to provide the highest quality care for our community. This year, we had many wonderful nominees. Let's take a look at those who were nominated.
Dr. Robert Bizard, Physician Services. Dr. Bizard is a caring and compassionate physician that has diligently served the Excelsior Springs community and routinely goes above and beyond in the treatment of his patients, staff, and community. He is a valuable asset to the greater Excelsior Springs community. Misty Lawson with Utilization Review. Misty transitioned to a hospital role with ease after the convalescent center closure. She is a quiet but positive influence on the team and welcomes new employees and processes. She is quick to seek out opportunities to improve her knowledge and always willing to help with any project. Amanda Ramazan, Accounting. Over the years, Amanda has provided countless hours of service both in her role at the hospital and in the community. Most of her efforts take place behind the scenes, but we should never take for granted the work that she does. Amanda also is well known in the community for her work with the Christmas Committee and other city festivals. Reynold Rose, nursing. Reynold is always assisting multiple departments to help every Excelsior Springs Hospital team member. He had provided leadership to the surgery department for process improvements, including the onboarding of new surgeons, equipment, and surgery needs. He is always the first one here and the last one to leave. Nicole Shields, nursing. Nicole goes above and beyond what is expected of a nursing supervisor. In all of my years of working in the medical field, I've never seen such a hard worker, driven for success for her team and the organization. I am grateful for her expertise and assistance to all employees. Lori Brookshire, Health Information Management. Although Lori is commonly known for her kind and caring attitude, her cool head during crazy busy times, and sweet smile, which make our day a little lighter, is her greatest contribution. She is enthusiastic to help others. Kelly Hillu, in nursing. Kelly is always ready to listen to a fellow staff member, handles conflict with a positive attitude, and is patient and encouraging when teaching. She is always ready and willing to help and leads by example. Devana Ishmael, Lawson Clinic. Devana is the perfect steward of what a determined, hardworking, reliable employee is. I project nothing but great things happening in her future as a wonderful representative of the hospital and its clinics. Keith Van Beber, Outpatient Clinics. Keith not only manages a successful department, he maintains a high level of knowledge and practice. He effectively leads his team, collaborates with multiple departments, and maintains excellent physician relationships. Logan Petz, Rehabilitation Services. As a coworker and a patient, I have found Logan to be one kind, compassionate, and helpful. He is agreeable to flex to any patient care setting we need him in and is eager to mentor students. I know that I can always count on him.
Hi. So earlier this week, we were happy to award tonight's winners. Let's take a look at some of those fun moments of surprise.
I don't know where my head is today. I forgot we've got another award to give in here. Is there a Dr. Robert Bizard in here?
Hi, Dr. Bizarre. Please join us at the podium.
You're not putting that.
There you go.
And another.
Arm hug.
We're here again representing the Healthcare Foundation, but this time we're presenting Commitment Caring Award to Dr. Bizard.
Woo-woo.
All right, thank you.
Your award nominee, Dr. Bizard. I don't have to introduce all of you to Dr. Bizard, but it is my honor to introduce you to Dr. Bizard. Dr. Bizard has been instrumental in the successful physician representation of the Excelsior Springs Hospital as one of the community's leading primary care physicians. He's positively embraced the physician practice merger and relocation to the hospital campus and has assisted our leadership team with input into the design and the workflow for the practice employees and patients. He's volunteered his time and his experience and expertise to ensure a positive outcome for the merger and opening of our new Excelsior Springs primary care. Dr. Bizard has routinely volunteered to assist the Excelsior Springs Hospital with finding solutions to concerns that have been presented in this past year, including regular consultation to all COVID-related activities and serving as one of our 2 hospitalist physicians this entire year. In addition to that commitment to the hospital and his physician practice, Dr. Bizard also serves as our medical director for Valley Manor and Rehab Center and provides medical care for many of our residents that live at Lawson Manor and Rehab and Excelsior Springs Nursing and Rehab. Dr. Bizard is most deserving of this award. He is a caring and compassionate physician that has diligently served our Excelsior Springs community routinely and goes above and beyond in his treatment for his patients, staff, and community. He is a valuable asset not only to Excelsior Springs Hospital but to our community. Dr. Bizard, because of your commitment to our patients and our employees and dedication to improving the outcomes related to the health of our community, we are so proud to honor you this year. Congratulations, Dr. Bizard. Thank you.
Yes, this is Dr. Powell, and I really hate that you're not here today because I wanted to do this in person. But we're here by phone to present you with the Commitment to Caring Award for this year. And we're so glad
really?
you
Misty,
That's so sweet.
you've been nominated by several individuals, and I want to read what your nominees said about you, okay? So here
Don't make me
goes.
cry. My heart are already.
Okay, start crying.
That's sweet.
It is my honor to introduce you all in the room to Misty Lawson. Misty transitioned to her role as the Director for Utilization Review in 2019, but Misty started her career with Excelsior Springs Hospital clear back in 2006, passionately providing services to our residents at the Convalescent Center before its closure. Misty Lawson is an exceptional resource to both nursing staff but also physicians. Misty took on a role that wasn't initially her area of expertise, but has shown initiative, passion, and dedication to learning the role. In her tenure as a utilization review nurse, she has increased our swing bed referrals, fostered positive relationships with other case managers and organizations, and has been an unwavering advocate for our nurses and physicians. She has a difficult position of working with insurance companies, a task that many people don't realize how difficult and time-consuming that is. Misty also has a phenomenal ability to connect with patients and families, ensuring they understand their care plan and options regarding their health care. Misty has also taken on projects providing school employees their flu vaccinations and has provided amazing organization and follow-through with the initiatives for our past 2 years. We are so incredibly fortunate to have Misty here with us and look forward to working with her for many years to come. Misty, because of your commitment to our patients, employees, and dedication to improving their outcomes related to the health of our community, we are so proud to honor you this year, and we can't wait for you to get back so we can hug on you, give you your flowers, give you your award, and say high five and thank you so much for all you do, Misty.
Oh, thank you so much.
I wanted to bring silly screen. Sorry for the interruption this morning, but we're looking for Amanda Ramazan. And we're here to present you with this year's Commitment to Caring Award.
Richard coming down the hall. Weird noise, it's usually Richard. Thank you.
In the spirit of having to do things a little different this year, would you please stand?
Yes.
Okay.
You hold like because they're gonna follow.
Yeah, they're like, fist pump, yeah, all that good stuff. All right. So I know that we all know Amanda, but it's my honor to introduce you to Amanda Ramazan. Amanda joined Excelsior Springs Hospital in April of 2012, and over the years, and especially during this last year, Amanda has provided countless hours of service, both in her role to the hospital and in our Excelsior Springs community. Amanda is a dependable and dedicated leader in our accounting department and consistently demonstrates initiative to take on additional responsibilities, projects, and tasks without any hesitation. Her work and oversight in the back office accounting functions impacts every one of us as employees, vendors, volunteers, and our community stakeholders associated with the hospital and foundation. Amanda's organizational aptitude and solid documentation practices have been attested by nearly perfect external audits for the last 2 years. For many years, she's volunteered without question to work with the Excelsior Springs Healthcare Foundation, the annual golf tournament, and the annual dinner. Great care is taken to make sure these interactions are as smooth as possible for our donors and our volunteers. With the activation in this last year of our hospital incident command system in March as a response to the COVID-19 pandemic, Amanda willingly volunteered to take on additional responsibilities as our finance section chief. And last but not least, Amanda has served on the Excelsior Springs Chamber of Commerce Christmas Committee for many years. This is truly a year-round commitment to making plans for our seasonal activities and events that bring us all joy. Amanda, because of your commitment to our patients, our employees, and dedication to improving the health and fiscal outcomes of our hospital and our community, we are so proud to honor you this year.
Thank you.
Congratulations. Is my face like I feel the
Well, Nicole Shields, we're here representing the Excelsior Springs Healthcare Foundation, and we'd like to present you with Commitment to Caring Award.
Thank you very much.
Kristen has a few choice words.
This is what your nominees said about you, Nicole. It is my honor to introduce you to Nicole Shields. Nicole joined the Excelsior Springs Hospital nursing team in 2013. She's been instrumental in our growth and clinical care and a constant go-to resource as long as I've known her. Nicole is a wealth of knowledge for not only providing exceptional patient care, but providing exceptional guidance to her team members. Nicole is willing to jump into any scenario to lend her expertise for the best possible outcome. Departments across the hospital look to Nicole for help and are always glad to see when she is here. Nicole has a can-do attitude and maintains her composure even when emotions are high. She's a pleasure to work with, and I'm so glad that she's on our team caring for our community. Nicole also has volunteered her time and expertise over the years with our community car seat safety events, partnering with members of the Excelsior Springs Fire Department and Children's Mercy to promote and ensure safety for our community and families. Nicole is always quick to take the lead on these events. We are anxiously excited to get back to hosting more community events and thrilled to have Nicole leading our initiatives. Nicole, because of your commitment to our patient, employees, and dedication to improving the outcome related to the health of our community, we are so proud to honor you this year and so thankful that you're part of our team.
Thank you.
Thank you so much.
Thanks to all who go above and beyond to offer such great health care to our committee here. Our community here.
In addition to the Commitment to Caring Awards, we also take time to recognize those who are considered up and coming. These awards are meant to recognize those who may be a newer face in the organization, but are already proving their commitment to the cause.
So now we're happy to announce this year's up and coming award winners.
Good job. Gloria, a few words from your nominee that we'd like to share. It's my honor to introduce you all to Lori Berkshire. Lori serves as an HIM analyst in our Health Information Management team. She transitioned to this role on June 1st, 2020, when coding operations were shifted over to another team, and she previously has provided coding services for both Dr. Bizarre and Dr. Pickett's offices. Lori had 1 day to train in the HIM analyst role before she was literally on her own. She quickly learned multiple and complicated processes for HIM operations, including the ROI and record scanning and analysis. Lori did so with grace while she began working with the new director and release of information teams to get them up to speed on her role as she was still learning. Her enthusiasm for helping others often manifests itself when she goes above and beyond to assist her coworkers and others with their needs. She is a tremendous source of knowledge of what we have always done and remains open to opportunities for change and improvements. Lori is known for her problem-solving skills and has become the go-to person for many different departments related to the HIM departments. Lori has a kind and caring attitude, her cool head during crazy busy times, and her sweet smile makes our day a little brighter. It is her greatest contribution. Lori is very deserving of the Up and Coming Award. She demonstrates her dedication to Excelsior Springs Hospital on a daily basis. Lori, because of your enthusiasm and willingness to go above and beyond, we're so pleased to honor you this year.
Oh, thank you.
And we can't wait to see that smile.
We're sorry to bother you. We're so sorry to interrupt your meeting,
Not
but
really.
we're here in search of Devonna Ishmael.
Hey,
Devonna, will you please join us at the podium?
Devonna, you have not completed
have
your
to come up
compliance
here?
training.
Thank you.
Oh, I'm there. Hi, Devonna.
Hi.
How are you today?
How are you?
Good. We get to do this.
Okay, I'm supposed to stay away from you, aren't I? Okay.
You're all good.
All right.
We're here representing the Healthcare Foundation to present you with the Up and Coming Award for this year.
Thank you.
And this is what your nominee wrote about you, Devana. It is my honor to introduce you to Devana Ishmael as one of our up-and-coming award recipients for 2020. Devana serves as the medical receptionist at the Lawson Clinic. She has served in this role since July of 2019, and she consistently provides outstanding customer service and care for our patients with the utmost professionalism and tact. While new to her role, she was initially trained in the Practice Allscripts EMR system, yet within 2 weeks of her start date, she laughs, she had to learn a completely new EMR system. She maintained her professional demeanor and never allowed this to disrupt the care provided to her patients. To the average bystander, they will never know that there was a change in systems due to her maturity and willingness to learn this new system. Devana is reliable, serving as the sole receptionist at our Lawson Clinic. She replaced a longtime employee, and practice patients have not noticed a decline in service or customer service that they've come to expect at our clinic. She always presents as mature, professional, friendly, and a source of knowledge for our Lawson service area. Devana is very deserving of the up-and-coming award. She is the perfect steward of what a determined, hardworking, reliable employee should be. I project nothing but great things happening in her future as a wonderful representative of Excelsior Springs Hospital. Devana, because of your enthusiasm and willingness to always go above and beyond, we are so pleased to honor you this year. Congratulations. Thank you.
Congratulations and many thanks to all of you to make our hospital a better place. To all of our nominees tonight, even bigger than the prize or the trophy at the end of the race is a recognition by your peers, your colleagues, and your community members. I thank you all so much for the care that you provide every single day. It's always thrilling to celebrate success, and we had so much fun this week. Wouldn't you agree, Dr. Powell?
I do, Kristen. And that's why I think we should keep that momentum going by drawing the first set of raffle winners.
I absolutely agree. And it's a perfect time to do that. However, I want to hear a word first from a couple of our outpatient clinic physicians.
My name is Sarah Gonzalez. I'm the Chief Nursing Officer here at Excelsior Springs Hospital. I am here in our outpatient clinic where we provide a variety of services, including dermatology, GI, we have a pain clinic, cardiology, you name it, your needs could be met here. We have an awesome team who's here to help you get medical care. And if you need an appointment, you can call the hospital and we can get you set up to see our doctors and our amazing staff.
Dr. Venkatadri B. I've been coming to this clinic since 2010. And initially I was with Heartland Hematology Oncology, but since 2014, I joined KU Medical Center, and I've been working for the university since then. I've continued the clinic here just to kind of be available as a service to patients here. And I'm here on Monday afternoons, every other Monday, and we provide consultation for both blood diseases, blood cancers, as well as for cancer or other kinds of cancers. And it's not just a consultation, we try to do some treatments here as well. Initially, we used to do a lot more chemotherapy, but now due to the costs associated with chemotherapy and the ability to provide cheaper care through the university, we've tended to treat patients requiring either chemotherapy or radiation at my clinics in the city. But whenever possible, we've been trying to treat patients right here to make it easy for them. And that is really our goal, is to kind of bring care closer to the patients than to kind of move them to the city. And so I think it's very helpful for patients, especially elderly patients who have had issues with transportation. And so I think that's something which can be encouraged. But of course, not everyone knows about the availability about this clinic. And so I think once they are aware of it, they may realize that it's a lot easier to come here than to go, say, to Liberty or to North Kansas City Hospital.
My name is Dr. Tom Scott. I'm a rheumatologist that comes once a week here to Excelsior Springs. I see patients in clinic. I've been coming now for 10 years. And I'm not sure a lot of people understand really what rheumatology does. I think they tend to think of it just as treating patients with arthritis alone. But we see people with what are referred to as autoimmune diseases, things like lupus and scleroderma and Sjogren's syndrome. A lot of people with musculoskeletal pain who don't have a diagnosis, we'll see them as well. We also, one of the big services we provide here is that we have an infusion center. So in the past 20 years of rheumatology, there's been a tremendous improvement in our therapeutics advances. So we have drugs now for common diseases like rheumatoid arthritis, psoriatic arthritis, psoriasis, something called ankylosing spondylitis, a condition called vasculitis, where we can administer medications either by injection or by through an IV, and they're done here at the clinic. And they're called biologics, and most people have seen those on TV. Drugs like Enbrel and Humira and Remicade, they're extremely effective. It really has changed the way we manage patients over the past 20 years. I mean, it's people with rheumatoid arthritis can go into remission, and prior to 1998, we really couldn't say that with the drugs that we had. We were limited to a small number of therapeutics. So what I think my biggest, since I'm here once a week, the most important thing for me is to identify the patients that I can really provide with benefit. So let's take, for example, osteoarthritis, which is the most common type of arthritis out there. Everybody gets it as they get older. If you x-ray people over 50, you're going to see it somewhere in their spine or peripheral joints. But the therapeutic options for osteoarthritis are quite limited. It's either anti-inflammatories or analgesics, sometimes injections. And for the most part, those can be managed by primary care providers. In fact, there are too many people with osteoarthritis for me to take care of them. So what I feel my role here is to see patients with rheumatoid arthritis, with psoriatic arthritis, with lupus, with conditions that can't be managed by primary care doctors because they're either complex or they're not comfortable prescribing the drugs, seeing them and treating them here. So that's how I see my role.
All right, let's get ready to rock and roll, folks. We're ready to draw our first 5 $50 award winners. Well, look who just walked in the door. What a special guest visitor, Madam Mayor Sharon Powell. Mayor, would you please draw our first 5 tickets for us tonight?
I would be glad to.
Yay!
The first ticket is 154, Brian Yarborough.
Ooh, yay, Brian, congratulations!
Okay, the second, oh no, it's me. I'm a pretty
Dang it, Dr. Powell
Wait a
says
minute.
rats.
And that second one's Dr. Powell.
Well, Dr. Powell can be drawn.
No, well, not when I'm doing it.
Okay, thank you.
Okay, 445, HD Architecture.
All right, one of our great sponsors tonight, HD Architecture.
Okay, number 3 is number 89, as again me.
I think it's rigged.
It's me. Tell me.
Dr. Powell's so disappointed.
Yeah,
Like I
really.
could have got rich here tonight.
Right. Okay, the third one is 382 NKCH.
That's North Kansas City Hospital. Another one of our great sponsors tonight.
252 Pro Electric. Some of our
Another great
sponsors.
sponsor tonight, winning their $50.
And our last one is 126 Kelly Elliott.
Kelly Elliott, great job.
Hey,
Thank you,
that's
Madam
great.
Mayor. We appreciate your help tonight. Yay.
That's definitely a great start for the night. The fun is only just beginning.
That's right. There are many more chances to win, so please stay tuned.
I'm ready to see those new physician offices that have just been moved here to the hospital campus.
Yes, we're thrilled to have our physicians, Dr. Bizard and Dr. Pickett, are here with us. Take a look at our new physician practice manager, Troy Grizzle, gives us a look inside.
Hi, my name is Troy Grizzle. I am the physician practice manager for Excelsior Springs Hospital. I'm standing in front of our new location. Excelsior Springs Primary Care. We opened in late September, and Dr. Pickett and Dr. Bizard's offices merged and moved to this location. So the practice was built out, and it was built to eliminate some of the duplicity that we have running two practices virtually less than a mile apart. So merging both Dr. Pickett's and Dr. Bizard's practices enabled us to reduce costs significantly and provide a better facility for the community of Excelsior Springs. So it's one long hallway here in the hospital, and it was converted in an old hospital space. It has 11 exam rooms and 1 procedure room. So I'll show you a typical exam room, much larger than your normal medical practice because these were old hospital inpatient rooms. Minor procedures, so Dr. Pickett and Dr. Bizard perform minor procedures here. It can be anything from vasectomy to mole removal, suture removal, suture application, you name it, they do it here. So that's it for our new practice. Thanks a lot, and I look forward to seeing everybody at our new practice.
That space looks wonderful. I know how happy you are to have everything here in one location.
We sure are, and we're also really happy to have our clinic in Lawson that soon will be moving down to the 6th Street in their downtown area. And also, don't forget our Express Clinic, which is located at the Price Chopper in Excelsior Springs. We keep adding more ways to get your health care that you need closer to home. And now, here's a word from one of our sponsors, Pro Electric.
Thank you for attending tonight's event. As an active community partner, Pro Electric is excited to celebrate the amazing dedication of these frontline workers. With over 44 years serving electrical customers in the Kansas City Metro, we understand the importance of building relationships and helping those in need. Much like community health care continues to change, we are also continuing to improve how we serve our customers. This year, we will begin to provide residential electric service in addition to the commercial service and construction we already perform. We are honored to be a sponsor of tonight's event and look forward to continuing to serve our customers in the Excelsior Springs Hospital community in the future.
We certainly appreciate Pro Electric and all of our sponsors' support with tonight's event. I'm ready to see a few more winners. Let's go ahead and do another raffle. We have 5 more $50 winners to announce.
Okay, but first, let's hear from a couple more of our outpatient clinics. They're here each week offering their services, so you don't have to drive very far.
Hi, I'm Dr. Terrence Coleman. I am a board-certified gastroenterologist. I've been practicing in this area for about 30 years now. I've been coming to Excelsior for at least 25 years, having outpatient as well as inpatient services available for consultations, follow-ups, GI procedures like upper and lower endoscopy, also known as EGD for esophagus, gastric, which is stomach, and duodenoscopy, which is the first part of the small bowel. We do that examination frequently. We also do colonoscopies, looking for polyps or cancers or screening for those things. We also have opportunity to take samples, and that can help evaluate problems like change in bowel pattern, unexplained weight loss, iron deficiency anemia, and a variety of other things. So we provide a full range of GI services here, and we have excellent anesthesia support, and the nursing staff is very well trained. Equipment is first rate, up to speed, and I can do most anything here that I can do at other facilities in the area that I'm also on staff at. So if I can be of any help, let me know. If you have specific questions, feel free to contact the clinic, and they can direct you to my office, where I can have my nurse take your name and number, and we can get back to you with answers to your questions. So thanks for attending this event, and we certainly appreciate support from the community here. Thanks.
Hi, I am Dr. Robert A. Shimwell. I'm a podiatrist here at Excelsior Springs Medical Staff. I've been here since 1997. My father was here prior to me. He's semi-retired. We provide outpatient services for people needing any foot and ankle ailments. Our services range from diabetic foot care to bunion surgery. We have physical therapy here on site. We do some wound care here as well. If you have any foot concerns or problems, please don't hesitate to come out and see us. Like I said, we do anything from gout to arthritis to plantar fasciitis, heel spurs, tendonitis. Most of these things can be treated conservatively without surgery. We also provide orthotics for our patients who need support with their feet. We do diabetic wound care as well as palliative care. So should you have any foot needs, feel free to come out and see us.
It's so great to see all these wonderful services right here in town. Now let's draw for the raffle. And how lucky we are to have Molly McGovern, Excelsior Springs City Manager. Molly, would you please do us the honor by drawing our next 5 $50 winners?
Absolutely. All right, I'll see if I can't draw for.
Can't. Yeah.
All those
Just don't draw
chances.
yourself.
Oh my gosh, 277, Rick DeHart.
What?
Yay.
No, we'll pop that back in. Sorry, love.
Sorry.
This is interesting. Okay, 420,
Kadeen Construction, one of our sponsors tonight also. Kadeen.
All right, 315, Dr. Nespri.
Oh, Dr. Nespri, our
Hey.
surgeon, yay. $50, Dr. Nespri.
239, Troy Gristle.
Troy, yay, a belated birthday present, Troy. Happy birthday.
395, McCarthy.
McCarthy. And McCarthy has asked us to donate all of their winnings back to our foundation this
Yay.
evening.
All right.
Thank you, McCarthy.
And last, oh my gosh, a repeat, 416, Kadeen Construction.
Kadeen Construction, another one of our award winners or sponsors tonight. Thank you, Molly.
Thank you.
Great. Thanks,
We
Molly.
appreciate you being here.
Congratulations to you all. Now I'm excited for you to get a sneak peek look inside our new community pharmacy.
Good morning and welcome to Excelsior Springs Hospital Pharmacy. This is a brand new pharmacy that was just built to service the hospital and the surrounding community. And we'd like to take you on a little tour this morning to show you some of the great features about our brand new pharmacy. This is our front counter area. So what you see through the glass is the patient waiting area. So our patients can bring their prescriptions in and just have a seat in the waiting area while we fill their prescriptions. We service hospital employees, who have our insurance, and they're incentivized to come to our pharmacy because not only is it convenient, it's more cost effective at our pharmacy, and they can just drop their prescriptions off or have them e-scripted and have them filled while they're at work. We also service any of the patients who go to the clinics. We're acquiring new insurances each and every day, so those are going to start rolling in, and we can fill prescriptions for the surrounding community. We're trying to be very convenient to service the community and the employees of the hospital at the same time, and the patients who also come to the clinics. When we pass through the medications, these doors cannot be opened at the same time. So when I am placing a medication, of course it will be packaged and push it through there, then the patient can open that door to receive their medication. And the same thing for any type of payment issue. They can either slip it through under the glass, or if they need to pass it through here. It's just a safety feature where it cannot be opened at the same time. This is our counseling area, and as you'll see, it's a private room so that our patients feel comfortable asking questions and discussing their medications and disease states without being out in front of the other patients, out at the glass where others can hear our conversation. You can always ask if you have questions to be brought into the counseling room, or we can ask you if you'd like to come in the counseling room to discuss your medication or your disease state in a little bit more detail without others being able to hear. This is our over-the-counter medication area, and this is just the stuff that we wanted to order to have on hand in case anybody coming by needs some OTC medications. Our employees, if they need something over the counter, they can buy it here. If we don't have it here, we can order it and typically have it here the next day at a very reasonable cost. At Excelsior Springs Hospital Pharmacy, not only do we service outpatients and fill outpatient prescriptions, but we also take care of the inpatients in the hospital. This is our medication fridge where drugs that need to be refrigerated, they will be in here. It's alarmed and monitored 24 hours so that if the temperature gets out of range, there is an alarm company that knows immediately and someone is contacted so that this is taken care of. Continuing our tour of the pharmacy, back here is our Pyxis area, and we have a Pyxis console that tells us exactly what medication is in every Pyxis machine in the hospital and exactly what drawer it's in, what cubby it's in, and we have a Pyxis tower. And then this leads us into our infusion area. This is a segregated compounding area, so not only do we do outpatient prescriptions, inpatient patients, we also run an infusion clinic where we can make or compound intravenous medications for those patients who come into that clinic. They can come weekly or monthly and receive those infusions at the outpatient clinic. This is a work area that we use in the pharmacy, and we fill some outpatient prescriptions back here. But one of the other areas of pharmacy that we also offer services to is to our Excelsior Springs Hospice. And we fill their prescriptions for them. And some of those patients may be in a nursing home, in which case we have the equipment to bubble pack their medications. So we put the drugs in here and label it appropriately, and then we're able to put it in this card to say that they take it in the morning. And that way at the nursing home, they have this bubble packed to know exactly what day they're on and when to give the medication. So that's just another area of pharmacy that we also provide here at Excelsior Springs Hospital Pharmacy. And I'd like to introduce you to our Director of Pharmacy, David.
Hi, thank you for allowing us to be a part of this wonderful event, and we look forward to serving the community of Excelsior for many years to come. Thank you.
It's so nice to have a pharmacy on the hospital campus, making it easily accessible to the primary care physicians and outpatient clinic patients. I love seeing the convenience that the hospital is continuously working to provide.
Well, we love providing it as well. So I think it's time, let's draw a couple more raffle winners.
Sounds good.
Wow, we're already up to our $100 winners, and I'd like to start with 3 names. And here to help with our drawing is Bill Westerheide. Bill, come on up.
Bill joined the foundation last year, and we're so very excited to have him with us tonight. If you haven't been out to the silent auction page, Bill and Westlake Ace Hardware donated a Weber smoker and grill and the cover. That item is valued at over $1,100. Go out and get your bid locked in.
We're ready to go, Bill.
All right.
Let's go for 3 good ones.
254 Pro Electric.
Pro Electric is one of our sponsors this evening. A lot of our sponsors getting that cash tonight.
Let's see. Number 65, Keith Van Beber.
Keith Van Beber, yay! $100, Keith, awesome.
That rolls.
I know who's buying lunch tomorrow.
Number 105, Andrea Reynolds.
Andrea Reynolds.
Yay.
Way, $100, awesome. Thank you so much, Bill.
Thanks,
Appreciate your help. The hospital's been working hard to offer a variety of specialized services to our residents in order to provide them better convenience in accessing health care that they need. In this next segment, we're going to introduce you to our orthopedic surgeons and dermatologists.
I'm Dr. Michael Justice. I'm an orthopedic surgeon with OSI. We're here every week. Dr. Cornett and I, we provide orthopedic service to the hospital and the community. We do various total joint replacements, fracture care. Personally, I'm a sports medicine focused physician, so I do a lot of ACL surgery, rotator cuff repair work, things along those lines, a lot of arthroscopic surgery. We have a pretty full gamut of orthopedic services that we can provide, so not too many things that we can't handle here at Excelsior Hospital. We do a lot of the same stuff that we do downtown at North Kansas City Hospital here. We have excellent facilities and instrumentation, good anesthesia crew and nursing staff, so we really enjoy being out here. in the community.
It's great knowing these services are just right up the road.
I agree, and just wait. There are so many more services that we're working to bring this way in the very near future. I think it's time to do another drawing for our raffles.
Right.
And how about we go for 4 this time?
Okay.
I think for this drawing, I am so excited to introduce you to Dr. Brad Hoffman, our Director of ED Services, and he's going to pull our next winners. Dr. Hoffman, how are you doing today?
Doing well, thanks.
Let's do this.
Glad to be here.
Yay.
537, Patty Shimwell.
Yay!
Hey.
Patty
All right,
Shimwell, $100. All right.
Number 6.
I think it's a 6.
Number 6, Scott Brown.
Scott Brown for $100. Woohoo! Halfway through, Dr. Hoffman.
290, Dr. Nespry.
Dr. Nespry again. We know who's going to buy dinner tomorrow. Congratulations, Dr. Nespry. We'll go one more.
Fourth one, 189, Vicki Probst.
All right,
that's
189, Vicki Probst. Great job. Thank you, Dr. Hoffman.
Thanks, Dr. Hoffman.
Appreciate you being here tonight. I do also want to thank our amazing medical staff this evening for the care that they provide every day, but also tonight for a generous contribution of $10,000 to the foundation. We can't do this without our sponsors and donations. I know I've said that a few times, and the medical staff really hit it out of the park this year, and we appreciate what they do for us. I'm really also very excited to bring you our next featured video, which gives you an introduction to our newest physician and Chief Medical Officer for Excelsior Springs Hospital, Dr. A.J. Strickland. Specializing in family medicine, Dr. Strickland brings a wealth of knowledge to our Excelsior Springs community.
My name is Dr. A.J. Strickland. I'm a family medicine doctor who's coming on board here at Excelsior Springs to also be the Chief Medical Officer. So a little bit about myself. I grew up on a small farm in south central Nebraska, and I learned a lot about living in small communities like this, and I really value having the opportunity to come and become part of a small community again, which is one of the drivers of my family deciding to make a move to Excelsior Springs. Some of the things that I'm really passionate about as a board-certified family medicine doctor is bringing stable, innovative primary care to your community. Aside from being a board-certified family medicine doctor, I'm very passionate about bringing services for substance use disorders into this community. Our community, just like every community across this great country, is struggling with opioid use disorder and addictions, methamphetamine, alcohol, and it's unfortunately come to a place where it's not just over there, it's in our own families, in our own workplaces, and it's affecting those we love the most. And so I've geared my practice a bit to making sure that I can provide comprehensive services to those who have substance use disorders, that they feel that they can get the needs met that they have when they need them. I think that we have that unique opportunity here in Excelsior Springs as a critical access hospital, but also as a comprehensive community health system that allows us the ability to be creative, to really bring innovative health solutions here close to home. Something that's high quality, but also convenient and accessible to even the most disenfranchised of the members of the community who maybe have felt like they haven't had access to quality health care before. I think that having the ability to get that high quality care right here at home is just what people in this size of community really want.
It's nice knowing there are so many committed professionals here to help. We look forward to getting to know Mr. Strickland, Dr. Strickland, excuse me, and welcome him to the hospital team.
So I need to put a quick plug in there. You just have a few minutes left until our auction closes. So if you haven't got those bids in, get busy. We're really fortunate also to have so many compassionate people that work here at our hospital. Now we're going to give you a look into our surgery suite. Reynold Rose is our Surgical Services Director and has just entered his 21st year here at the hospital. Reynold will give us an inside look at what's being done in surgery, and then we'll hear a quick tidbit about our dermatology services.
Hi, my name is Reynold Rose. I'm the Director of Surgery here at Excelsior Springs Hospital, and we'd really like to make sure that everyone knows how much we enjoy taking care of our patients, and we'd love to have you come here and have surgery with us. And this is Dr. Nespri. He's our general surgeon, and he does a lot of the robotic surgery along with urology, does some, and we have gynecology doing some too, but he does the bulk of all our surgery here.
Hello, I'm Dr. Nespri. This is the Da Vinci that we got here over a year ago. And it is very versatile. As he was saying, we can do urology, gynecology, general surgery, all kinds of things with this. These are called trocars. This is what we put in the person's abdomen. If we do something laparoscopically, these will move a whole lot while we're moving it. Doing it with the Da Vinci, it will move just minimal. So people don't have the torsion on their skin, so it doesn't hurt as much. So I'll show you how this, after the patient's asleep, I'll make an incision, and I'll put these trocars in place, and then we hook it up to the robot. And these are the instruments that we use. You can see how skinny they are. And when I sit down at the console after I've already made the incisions, I will then be able to control all four of those arms myself. So this is the console where the surgeries are done. So I put my head into the view box, and this is where I can see the three-dimensional and magnified by 10. These are the instruments I use for my hands that move those trocars that I showed you earlier. And then the instruments down here I control with my feet. So I can move the camera and zoom in and zoom out. So here's an example of how the machine works. You can see that this patient has a hernia and there's bowel content up in the hernia defect, and you can see how I'm pulling it out and how easy it is and how it comes out effortlessly with this machine. It's really changed the way we do things, and it's a big, big plus for us here. So this is the tower that runs everything. This has the brains of 7 cell phones. It's very, very high tech. We are logged into Atlanta constantly, so they can monitor everything we do, all the movements that we do. And if there's ever a failure or an instrument that doesn't work, they can tell us immediately what the problem is, and then it's corrected. So we are never out here alone by ourselves. They're always in contact with Atlanta, and all of the Da Vinci's are that way.
Hello everybody, my name is Dr. Maria Tonkovic and I am dermatologist here at Excelsior Springs Hospital. I am a general dermatologist, which means that I'm treating different kind of new or chronic rashes like psoriasis, eczema, different kind of allergic rashes, also skin infections like staphylococcal chronic infections, then also warts, blistering disorders, and many other different type of skin diseases and disorders. I'm also a surgeon. I'm offering actually services of dermatologic surgery. I'm excising skin cancers, cysts, bumps, lumps, wherever you have on your skin. We can majority of that remove and excise. And also I am performing services of cosmetic dermatology like Botox injections and fillers. It's been my pleasure to be here. Everybody is very nice and willing to improve dermatology clinic experience and services. And I hope that we will work on that improvement in the future.
Wow, that's amazing what modern technology can do.
Our health facilities have been making an investment into technological advances over the years that are leading edge when it comes to healthcare. Already within his first 15 months at Excelsior Springs Hospital, Dr. Nespri has completed over 250 surgeries and counting.
Wow. Well, we only have 3 more raffles to draw before finding out who our big winner of the night is. With big money draws, I think it's only fitting that Cameron Meyer, our Excelsior Springs Hospital Chief Financial Officer, come forward to draw.
Yay!
Come on up, Cameron. Let's draw for the last three $100 winners right after this.
Good morning. My name is Dimitri Maragos. I'm a cardiologist from Liberty Hospital. This is Bobby and Nicole. We're the cardiology team that comes up here twice a month to offer cardiac care to the patients in the area. We can see new patients. We can see follow-up patients. We can do stress tests up here, general cardiac care, and hopefully start the process if anyone's having any cardiac issues, chest pain, shortness of breath, to start their follow-up and evaluation here before we may need to go elsewhere for any additional care. It's a joy to come up here. We've been coming up here on and off for probably about 20 plus years in a different form, but we enjoy the hospital and we enjoy coming up here. Thank you very much, and if you need us, come see us here.
Hello, I'm Dr. Hamilton. I'm an interventional pain physician. My main hospital is the St. Joseph Health Center in Kansas City, but I travel to critical access hospitals. One of them is Excelsior Springs. I've been coming here for approximately 2 months now, and the reason I've chosen this hospital is because of the services provided. I found that the clinic, the outpatient clinic, is extremely good. The nurses are very good. The operating room is top grade, and so it allows me to do the things that I do. In interventional pain, I primarily treat the spine, and I can be the mid-back, the low back, and the neck. Things in interventional pain usually start with injections, and they're called, for the most part, steroid epidural injections. We're putting a real strong anti-inflammatory agent around the spinal cord, around the nerve roots. We try to reduce the inflammatory reaction caused by bone spurs or disc protrusions, things on that line. I also see patients who have had a back surgery or multiple back surgeries, or people who don't qualify for back surgery because their pathology is just too severe. If a person doesn't respond to epidural injections, then we may think about several things. One of the primary things is the spinal cord stimulator. It's a little device that we put electrodes along the spinal cord, attach them to a power pack that is put underneath the skin, and we deliver a little electrical impulse to the spinal cord to help block the pain. I also treat compression fractures. People who have osteoporosis or thinning of their bones can have a collapse of their vertebra, and I don't want those vertebrae to collapse down to nothing, because then you get the typical patient who is bent over walking in the store and looking at the floor. So we put some cement in those vertebrae to stabilize them. There's also several other implants that I would do to reduce the pressure on the spinal cord or reduce the spinal stenosis. They're little separators that expand the spine to take the pressure again off of the spinal cord. I also put in what's called intrathecal pain pumps. So people who are taking a lot of pain medicine and that isn't even effective, we'll put a little catheter along their spinal cord that attaches to a device called a pain pump that's placed underneath their skin, and it's filled with real strong analgesic or pain medicine to help the person cope with their pain. I also do a lot of nerve blocks to help block the impulses that's arising from a part of the body that's noxious or painful. And then we might use a little electrical impulse to help burn those nerves. So I hope this gives you an idea of some of the procedures that I do, and I'd certainly look forward to seeing patients in the future at Excelsior Springs Hospital.
And we're back. Cameron, let's pull some money. Big tickets, $100.
577, Kimberly Sanson.
Kim Sanson,
Hey.
577.
Great.
Woo woo, $100.
460, CPSI.
CPSI, one of our vendors and sponsors tonight.
And 133, Anita Bowman.
Anita Bowman, $100. All right.
That's great.
Thank you, Cameron.
Fantastic.
Appreciate you being here every day. More than you know. We do have a bit of a surprise tonight. Your chances to win aren't over yet. We still have our $1,000 drawing, but we also had some last-minute prizes that got added into our pot tonight. But first, we want to share a feature of the night taking place in our emergency room with Dr. Brad Hoffman.
Hello, my name is Brad Hoffman. I'm the Emergency Medicine Director here at Excelsior Springs, and we're going to take you on a little tour of the emergency department. So, this is the room we generally do not like to use because this is our major resuscitation room. If we have someone who needs resuscitative measures, whether they have a traumatic emergency or a medical emergency, cardiac, pulmonary, traumatic, this is where we resuscitate those individuals. And during a regular day, this room would be for someone who is otherwise pretty stable, but maybe having some sort of cardiac or pulmonary issue, or stroke. Stroke comes to this room, again monitored. This is our robot that we have called Stella. If we have someone who has a stroke, we activate what's called the hyperacute stroke protocol. And this automatically gets us within 20 minutes. We're in touch with a board-certified neurologist, and their little face pops up here, and they can actually steer this robot around to make it look at the patient. It steers up and down. It's kind of creepy, but it's really pretty cool. The patient will talk to the neurologist. I can talk to the neurologist. We can both get on screen, and we can make determinations of some pretty significant interventions if we elect to do that if the patient qualifies. Another crash cart right behind if we need that. But this is our stroke room and our otherwise stable cardiac pulmonary room. And room one, this is our triage room. People come in here to be initially evaluated by the nurse. It is a negative pressure room, which means it has airflow designed to mitigate the spread of COVID-19 or other airborne pathogens like tuberculosis. It is where we would keep someone who is really high suspicion if we can. If we're having a high volume, we will simply take extra respiratory precautions and use other rooms. So this is our small emergency department at our beloved critical access hospital, and we are obviously not a cardiac cath center or major trauma center, but we feel like we serve our function to the community in the best way that we can.
Really amazing seeing all the wonderful people and ways in which your staff are working to reach out and heal the community.
We truly do love what we do. And with that being said, we're down to our final raffle drawing of the night before we find out who our $1,000 winner is. And we've got a couple of bonus giveaways that we're going to offer up. 2 $100 McKeever Price Chopper gift cards. What? Wait a minute, I'm just being told that we actually have 3 $100 Price Chopper cards.
Great.
I am in such awe tonight of how generous our sponsors and our donors have been in this community. And I think it's only right to have Christy Marker, our long-term Excelsior Springs resident, help us with our drawing for our Price Chopper gift cards. Christy, you having fun tonight?
I am.
Very awesome. All right, let's draw 3 $100 gift cards for Price Chopper.
308, Dr. Nespri.
Dr. Nespry's going to owe us big tomorrow.
214, Brianna Deal.
Brianna Deal. 214, $100 gift card to Price Chopper.
Oh, this one's good. 228, Reynolds Rose.
Yay, Reynolds Rose. Awesome. All right, guys. Christy, thank you so very, very much.
Now the moment you've all been waiting for. Our golden ticket drawing.
So we need to take a minute and add all of our gold ticket buyers into our pot. They are denoted in red. And we will stir the pot. Before we get started with this, Chris, do you have some final numbers for us tonight?
their sponsors and donations.
Come on up.
We've collected $38,250.
Wow.
$38,000 from our sponsors team. Thank you so much. That's awesome.
We sold 585 tickets. $5,874.80.
Awesome.
Fantastic. That's
Thank you
great.
so much.
Thank you, Chris. And to do the honor, we all agree that the honor should go to a person that deserves to be recognized tonight. Christine Regal is the administrative coordinator and foundation director. She has worked tirelessly to get this whole thing together. She has worked night and day, and we just can't thank her enough for all she's done for us. And
Thank you, Chris.
a little token of appreciation.
Couldn't have pulled it off without Chris this year. We're so excited, Chris. So, do you want to do the honors?
Yes.
All right. We'll shuffle, shuffle, shuffle. And no peeking. $1,000, team. Here it goes.
The big one.
Misty Lawson.
Whoa! How awesome, Misty! Woo! Clack, 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 clack.
Yay!
How awesome. We're so excited. Congratulations to all of our winners tonight.
Yeah, that's fantastic. Well, that's all for us tonight. I also want to give a big thanks to Morgan Sites.
Absolutely.
They worked so hard to handle all of our online presence, and they have been excellent. Just
Awesome.
amazing. Put in all kinds of time, and so we greatly appreciate that. Thank you so much
Thank you.
for your service.
Thank
So, thanks for tuning in, and a special thanks to all those who participated in tonight's event. Another special thanks to our sponsors.
Thanks all. Have a good night.
Bye.
Bye.